Please welcome Kareem Elbayar, Technology Partnerships Advisor of UN Office for the Coordination of Humanitarian Affairs.
Well, good evening, everybody. I have to say that the only person I really didn't want to follow was the Kingslayer. So, not only did I get the Kingslayer before me, but we have a really cool musician after me. So I'm going to try my best to keep you all engaged with the UN side of the house. My name is Kareem Elbayar, and I work for the UN's Humanitarian Office, commonly referred to as OCHA. And at OCHA, we are responsible for mobilizing and coordinating the humanitarian system. That means UN agencies, NGOs, private companies, and many others, whenever there's a crisis. And unfortunately, that happens to be quite a lot these days. What I want to talk about with you today is what OCHA is doing and how OCHA is working to use technology to help improve the lives of people who are affected by conflict, natural disaster, and other kinds of emergencies. So let me start with the problem. And to best illustrate the problem, I think it would help to go a few years back and set the stage with a crisis we all remember well. And that's the Ebola outbreak in West Africa. It started in December 2013 with a few isolated incidents. And as you can see, early on, we thought it was going to be an outbreak much like the last 10 outbreaks of Ebola that we had in the past. In fact, within 6 months, experts were predicting that cases were on the decline. And you can see the number of daily infections just after 6 months there, where we thought, okay, it's coming down. And in fact, we can start to send the doctors home. We can start to demobilize. That would have been really great news, except for the tragic fact that it turned out to be completely wrong. And here you can see what the trend line actually looked like. Within a few months, the number of daily infections were skyrocketing, off the charts. By the end of 2016, more than 28,000 people had been infected with Ebola, and more than 11,000 people had died. In fact, it turned out to be the longest and deadliest Ebola outbreak in history. So how could that have happened? How could we have missed the warning signs? It turns out that the warning signs were there all along. It's not that the information wasn't being gathered or that our data was incorrect. The problem was that we had many dozens of organizations collecting and reporting Ebola information on their own. Most of the reports looked like this, and I think those of you who work in an office are probably familiar with these kinds of PDFs that are locked. You can't copy and paste. You can't do anything with them. There was lots of different information coming out and being distributed in a lot of different ways. And as a result, humanitarian responders simply were unable to compare data, visualize trends, or understand what was happening on a regional or multi-country scale. And because of that, we were not able to paint an accurate picture of the response. And as the New York Times reported toward the end of that year, the most tragically missed opportunities during the Ebola crisis stemmed from the poor flow of information. So the Ebola crisis really drove home for us the importance of data management in a humanitarian emergency and the consequences of our failure to do so. And it was during that time that OCHA launched the Humanitarian Data Exchange, a platform dedicated to making data of this type, humanitarian data, easy to find and use for analysis. During the Ebola crisis, our data team actually sat and extracted information from dozens of different sources. They sat and read through those reports and entered the data from the PDF files into these kinds of spreadsheets, open, shareable, standardized spreadsheets. In doing so, we then uploaded our spreadsheets to the Humanitarian Data Exchange site. And thousands of individuals and organizations downloaded our data set, the open data set, and used it to predict trends, clarify needs, and inform their policy choices. The New York Times actually used our open data set to generate this visualization you see behind me. And you can see that this is a much more useful tool for humanitarians, emergency responders, and affected people themselves. You can see the number of infections, you can see the trends. But it's not enough for us to just get data into open formats. We also need to be able to make sense of large quantities of information very quickly. For example, after the Nepal earthquake in 2015, the UN conducted a series of community surveys asking people what they needed, a crucial first step in delivering aid. This sort of research takes a lot of time to collect, not to mention to analyze, interpret, and act on. Historically, the results of these surveys are generally not available to us until months later, too late for us to use to adjust our programming, too late for us to use to improve ongoing relief efforts. But by using OCHA's new data platform, we converted thousands of individual interviews, survey responses, into simple, clear visualizations and reports. And you can see one of them right behind me, making it much easier for humanitarians to interpret and act on the information that they had at hand. Now, the world seems to be getting more complicated and more dangerous every day. By the UN's estimates, more than 140 million people are in need of humanitarian assistance this year for their survival and protection, more than at any time since World War II. But we're also more connected than ever before. Never in human history have so many people been able to communicate so instantaneously. We are now in the middle of 2015, or the end of 2017, I should mention, rapidly approaching 5 billion individual mobile phone subscribers, more than 2/3 of humanity. More than 50% of the global population now has access to the internet, and more than 1/3 are regular users of social media. And all of this represents for us an incredible opportunity to make humanitarian response more effective, more efficient, and more responsive to the needs of affected people, but only if we can start to make sense of this enormous flood of information that's available to us. Now, we saw what's possible just a few weeks ago in Texas during Hurricane Harvey, as thousands of people went online to ask for help. And you can see some of those tweets and Facebook posts that were happening. This is a live map. Thousands of people went online to say, I need assistance, I'm trapped in my home, I'm here, I'm there, can you help me? And hundreds of individuals and organizations responded, volunteers of all kinds, and you can see some of them here. A group of people calling themselves the Texas Navy just volunteered, showed up with their own boats, and went door to door trying to respond to these requests for assistance. And all of this is really why OCHA has established our new Center for Humanitarian Data in The Hague. Our vision is a future in which all people involved in an emergency have access to the information that they need, when and how they need it, in order to make responsible and informed decisions. As we saw in the Ebola case, the ability to do that, the ability to access and to understand data, will save lives in a humanitarian emergency. However, time is really short, and we've only just started to scratch the surface. So here are some of the things that we think need to happen in order to get us to that future. First of all, we believe that establishing data standards will speed up the flow of critical information. In an emergency, we can't spend time trying to figure out if the letter M stands for males or millions. And we can't figure out a lot of different databases that are in different languages. We just don't have the ability to do that. So what we're doing is trying to find a way for humanitarian organizations to work together and ensure that we speak the same language. And we're doing that by developing a humanitarian exchange language, or HXL. HXL is based on open source hashtags, just like the ones you know from social media. But by using HXL, data from many sources can be combined more quickly for insight. We also believe that once you have this standardized data, sharing it will make it easier to help people in need. So much information is being generated in humanitarian emergencies, but we need agreements to make the sharing of that information part of our standard operating procedures. If UNICEF is looking to distribute food or other types of assistance to children in need, and Oxfam has already conducted a survey of a given location to identify those children, then UNICEF should be able to access and utilize the information that Oxfam has generated. They shouldn't have to reinvent the wheel and conduct a time-consuming and expensive needs assessment of their own. So we're working to solve this problem by developing data sharing agreements that will allow us to share information between humanitarian agencies and even with the private sector while protecting individual privacy. We also believe that humanitarians need to learn new skills to make us better at our jobs. After all, there's no point in having all of this data if we can't make sense of it. So we've established a Humanitarian Data Fellows program, which will also come out of our data center in The Hague, which will bring experts from the private sector and academia to work side by side with humanitarian organizations on data challenges and help make humanitarians more adept at being able to use data for decision making. Most importantly, we believe in the power of the network. Our new Center for Humanitarian Data in The Hague is not really the center of anything. We want to be able to work with people all around the world. It's just a location for us, but you can be working from anywhere. We cannot do this alone. We invite your organizations to work with us to adopt data standards, share information, and upgrade your workers' data analysis capacity. If you're already a data expert and you're in the audience, I invite you to join our Humanitarian Data Fellows program and help us to figure out how to do this more effectively and efficiently. If you're a donor, we would love your support, of course. but we also encourage you to contribute to other efforts being done by many different parts of the humanitarian system to develop this emerging humanitarian data ecosystem. What we want to do is work together to get humanitarian data flowing so that we can tell richer, more nuanced stories about people in need in a crisis and what we need to do to help them. Together, we can work to connect people to data to help improve lives. Thank you.